You must have heard of COVID-19 and flu, but do you know what is respiratory syncytial virus? If not, then in this video I will talk about it. RSV is a contagious virus which causes respiratory infections. Each year it causes more than 33 million episodes of lower respiratory tract infections, more than 100,000 deaths, and 3.6 million hospital admissions. Unfortunately, most of these occur in low middle income countries. Respiratory syncytial virus causes both upper and lower respiratory tract infections. Among the upper respiratory tract infections, it causes otitis media or the ear infection. It also causes pharyngitis and acute rhinitis. So it can also cause lower respiratory tract infections such as bronchitis, bronchiolitis, and in severe cases pneumonia. In fact, RSV is the leading cause of lower respiratory tract infections globally. Symptoms of RSV they overlap with some of the other respiratory diseases such as COVID and flu, and common symptoms include runny nose, wheezing, coughing, fever. But it's important to know that all these symptoms they do not occur at once and they rather occur in stages. Although RSV can cause infection in all age groups, however, children under 6 months of age and elderly above 60 are at most risk of getting severe disease. So there are two licensed vaccines of RSV. One is manufactured by GSK and one by Pfizer. Both these vaccines are recommended for elderly 60 and above. The vaccine of Pfizer can be used for pregnant women during 32 to 36 weeks of pregnancy to protect the infants. So these vaccines are in use in US and in some of the European countries. However, at present, the RSV vaccine is not available in Pakistan. RSV shares clinical symptoms with some of the other respiratory diseases such as COVID and flu. So it's highly important that people should get tested. And there are two testing regimes that are available. One is the rapid antigen test and then PCR-based test. RSV is a seasonal virus and it causes peaks in winter in Pakistan. And we have seen that during the past 2 months, positivity of around 20 to 25% has been reported. Because RSV spreads through respiratory droplets, so the preventive measures remains the same as they were for COVID-19. Also, it is important to mention that necessary steps should be taken to protect high-risk groups, which include infants below 6 months of age, elderly above 60, and people with underlying health conditions. So one of the reasons could be the uplifting of different measures that were taken during the start of the pandemic, such as using of masks, social distancing, and smart lockdowns. However, with the uplifting of these restrictions, other respiratory diseases have increased, and such is the case with RSV. Secondly, our surveillance system has improved, and diagnostics facilities they have also expanded. So this could be one reason why we are seeing more cases of RSV reported from Pakistan. And thirdly, it could be due to the immunity gap in which social distancing, masks, and lockdown they weaken population resistance to other pathogens.